Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary for athletes and active people on all sorts of sports and exercise injuries and injury treatments and injury prevention so that you can stay healthy and perform your best. Now, as an orthopedic surgeon, largely a lot of what I do and what other sports medicine orthopedic surgeons do is surgery. We fix things surgically. I do it mostly arthroscopically through the scope, but it can be through open incisions. But yes, we're surgeons. Fortunately though, a huge number of injuries that we see, patients come into the office with, whatever the injury or whatever the pain, very often they don't need surgery. You may be one of these people that's dealing with a knee injury or a shoulder injury or whatever it is and worry about going to an orthopedic surgeon because you're afraid you're going to be told you need surgery, but so often we see injuries that don't need surgery. And then it gets to, well, what does it take to get it better? And a lot of times it depends on the injury. It could be physical therapy, it could be taping, it could be an injection potentially, it could be a brace. And so in today's Ask Dr. Geier video, I actually wanted to discuss brace treatment for one of the common injuries of the knee. Sully asks, I've torn my MCL, grade 3, and I just want to know if I should wear the knee brace while I'm doing my home exercises. Well, that's terrific. And I think it's important, before I discuss the brace specifically, let's talk about MCL injuries. The MCL is the medial collateral ligament. It's a ligament on the inside of the knee, or the side of the knee closest to the midline, as opposed to the outside or the lateral side of the knee. And it's injured very often. You see it a lot in professional football or college or high school football, where somebody hits the player on the outside of the knee, driving the knee in, and it injures that medial collateral ligament. There's other ways to do it, but that's a really common mechanism. Now, unlike, say, the ACL, we talk about the anterior cruciate ligament in the center of the knee all the time, and how people very, very frequently need surgery for an ACL injury because we need to restore stability of the knee so they can get back to sports. The MCL, fortunately, almost always heals on its own, even if it's a grade 3 injury, basically a complete tear. You can have milder forms, grade 1, which is essentially a stretch of the MCL, or a grade 2 injury, which is a partial tear. Those obviously heal as well, but even a grade 3 MCL injury, a complete tear, can heal without surgery. The treatment involves a knee brace. Basically, the athlete wears a brace that lets the knee bend and straighten out, so you can get fully straight, you can get fully bent, but it eliminates any side-to-side motion of the knee, basically protecting that MCL while the ligament heals. And yes, you pretty much wear it all the time, especially early on. You can take it off to shower and bathe, that kind of thing. Take it off maybe once in a while just to let your knee breathe, but for the most part, you want to minimize any side-to-side stress. And again, the brace is usually unlocked, so you can your knee shouldn't get stiff because it's bending and straightening out. But yes, I'm a big fan of using that. If you do it in a controlled setting, like in physical therapy, sometimes they will take it off because they can do some more aggressive exercises and overall rehab. But generally, especially early on, I think that brace can be really helpful. Get that ligament to heal as quickly as possible and make sure it does actually completely heal. Now, have you had an MCL injury, and how did your orthopedic surgeon or your doctor treat it? Did you have surgery? Were you one of the rare ones that basically do need surgery, or did it do well without surgery, and how long were you in a brace? I'd love to hear your experiences. So below this video, I'd love for you to share your comments. It would help other people that may be dealing with an MCL injury, and I would love to basically hear your experiences as well. And if you know somebody going through recovery from an MCL injury, or maybe he or she just tore his MCL, I should say, share this video with them. I would love to help any way I can. Now, if you like videos like this and you want more information on sports and exercise injuries and injury treatments and maybe injury prevention, subscribe to my video channel. I record a couple of these videos every single week, and I'd love to share those directly with you. And last, go to my website, drdavidgeier.com, enter your name and your email. There's so many resources I create on ways to stay healthy and perform your best, whatever your sport or whatever your exercise, and I only share them by email. They're completely free, so sign up and I'll deliver those with you. I look forward to connecting with you that way. Thank you so much for watching. I look forward to answering more of these questions. If you have a question you'd like to send that I can answer in an Ask Dr. Geier video, send those my way, but I look forward to seeing you right here next time.